Recognizing the member for Chilliwack-Kent.
Thank you, Honourable Speaker. Approximately 75% of serious mental health issues emerge before the age of 25, and it can be difficult to know where to turn for help. Making sure young people have the supports they need to succeed in life is a top priority. Wellness promotion, prevention of mental health problems, and early intervention can prevent small problems from becoming bigger ones down the road. And the earlier we provide the support, the better the outcome. Young people are facing more stress and anxiety than ever given the pandemic, the toxic drug crisis, climate emergencies, and so much global uncertainty. Data from the McCreary Centre's 2023 BC Adolescent Survey shows the mental health of youth has been declining overall, with increased rates of self-harm and an increase in drug use. We have seen an increase in mental health challenges since 2018. 60% of youth said they had a good or excellent mental health, which means 40% did not, compared to 73% who reported positive mental health in 2018. Self-harm has risen, 24% self-harmed compared to 17% in 2018. 1 in 5 students miss school because of mental health challenges. Overall quality of life has decreased since the last report, and stress was higher in higher grades. The need for supports for our youth is something I see and hear regularly in my community, which is why I was thrilled to see the advocacy of my community succeed recently when 10 new Foundry Centres were announced earlier this month and Chilliwack was selected as one of the locations. I wasn't alone in celebrating this win for the youth of our community. Chief Derek Epp from Chilliwack-Kent First Nation said accessing care can be overwhelming, especially if you're young. And this centre means that youth in Chilliwack can have a one-stop shop to getting on track with the care they need. Jason Lum, chair of the Fraser Valley Regional District, said this is great news for Chilliwack and the region. I know how hard local advocates worked to make the case for a foundry. This provincial investment will be welcome and go a long way to ensure young people who need support aren't being left behind. And Terry Westerby, school trustee for School District 33, said stronger services for youth is indeed something to be celebrated. There are young people in our community who really struggle with mental health and addictions issues, and these additional supports will help expand the scope of care and help youth in Chilliwack with a hopeful and happy future. Foundry Centres offer a free, inviting, and non-judgmental, safe place for young people ages 12 to 24 of all backgrounds to connect to the care they need. And our government has been focused on delivering increased access and availability of mental health and addiction supports to youth across the province, providing more opportunities for families and communities across BC to connect with wellness services, including free mental health and addiction support, drop-in counselling, physical and sexual health care, youth and family peer support, and social services. Because the well-being of young people in British Columbia is a top priority. I've discussed the Foundry Centres, but Honourable Speaker, that is only one piece of this critical work for youth. The province has invested significantly in improving mental health and addiction services for young people throughout our province, with a focus on early intervention and prevention services, crisis support, and treatment and recovery. Integrated child and youth teams, ICY teams, help to fill gaps in mental health and substance use care, bringing together multidisciplinary teams and removing roadblocks to deliver better care. On the ground, these teams help families navigate services and provide mental health and substance use supports for children and youth. The province committed $55 million to implement these teams in 20 school districts by 2024 to be fully operational by 2025, including one team currently in development to support students I serve in Agassiz Harrison and the neighbouring Hope. We know how important treatment and recovery services and supports are to the well-being of our youth. One piece of these supports are bed-based care. The province has committed to doubling the number of youth treatment and recovery beds to increase their availability in all parts of British Columbia. As of March 2024, 72 new publicly funded youth treatment beds have opened, and it's anticipated that the additional new 28-bed sanctuary program at Covenant House will be open in June of 2024. There are 170 publicly funded youth substance use beds throughout our province. Bed-based treatment represents only one of a much broader spectrum of treatment options for people living with addictions. Beds are typically most appropriate for people who require a higher intensity of services and supports to address complex or acute mental health or substance use needs. Children and youth can also benefit from accessing a range of important outpatient treatments. Mental health and addiction supports for young people can be found at urgent and primary care centres in 32 locations in BC, where clinicians are available 365 days a year for same-day access. Support for youth is also available through community-based primary care networks, which build a team of professionals around a patient and their needs. The networks also improve access to early intervention for people experiencing mild to moderate mental health and addiction challenges, and to more specialized supports where needed. In 2021, the province invested $75 million over 3 years for early psychosis intervention, which expands existing specialized programs, increases access to treatment, and helps young people and their families thrive. Child and Youth Mental Health Intake Clinics, CYMH. There are 93 of these CYMH intake clinics across the province. Clinicians provide initial assessments and ensure children and youth are connected to the right supports. CYMH teams can provide support through individual or group family therapy, interventions, and in-home support. Y-Mind is a free 7-week early intervention program for young people 13 to 30 experiencing mild to moderate anxiety. Programs are offered in person and virtually and are grounded in mindfulness and acceptance and commitment to therapy to teach participants skills to effectively cope with their anxiety. The program also has been adapted for Indigenous communities as the Mind Medicine program. And there are crisis supports. Here to Talk is a 24/7 counseling and referral line connecting post-secondary students to services where they need it. And the Kids Help Phone is a 24/7 immediate counseling and support, offers information and referrals. It has been a hard few years, and youth have been asked to be resilient, flexible, adaptive, all while transitioning into adulthood in an ever-changing, sometimes threatening reality. There is not one size fits all, Honourable Speaker, which is why the supports I have described are so important. But my message is that there is hope and there is help. Please reach out for support if you or someone you love needs it. Thank you. I look forward to continuing after hearing from the member opposite.
Thank you, member.